Hello, my name is T.R. Morris. I'm a licensed naturopathic doctor and also an IFM certified practitioner. Today, I'd like to talk to you about how we can make routine laboratory testing more affordable to you and also to offer and announce a special I've got for new patients going through June of 2018. First, let's review the four pillars of good healthcare, and this is true whether you're seeing a naturopath, a nurse practitioner, or a medical doctor. You should be getting regular checkups with this provider. They should be asking you to discuss any current health issues, and that should lead them to order routine and concern-specific laboratory testing, and that's the focus of this webinar today. Lastly, they should be making personalized recommendations to you that address the cause of any obstacles to your optimal health that you're experiencing. And this is an area where naturopathic doctors and functional medicine doctors especially shine and offer something beyond what most conventional doctors are able to offer. Let's get into the laboratory testing, the first of which is a complete blood count, or CBC, and this includes a measure of both your white and red blood cells and gives us some insight into your iron stores. Second test is a metabolic panel, and that includes, very importantly, blood sugar, which is how we look at your risk of developing diabetes or metabolic syndrome, and also includes other organ function measures including ones for your liver and your kidneys. The third test is lipids, and this is the classic test for cholesterol and triglycerides, and it's a good indicator still of your risk of developing cardiovascular disease. The fourth test is thyroid function, and this is measured through TSH, or thyroid stimulating hormone. And this is the most basic test that most providers are willing to order to look at your thyroid function. There are more advanced testing that should be ordered if this marker is off, but it's just kind of the gateway to that testing. And lastly, urinalysis, which is a measure of kidney function and also gives us an insight into other disease risks you may have. The good news is most providers will order these tests, and insurance frequently covers this testing if that's part of your plan. The not so good news is that there are 5 additional tests that I order on almost all of my initial patients to really do a more careful job of monitoring for disease risk and monitoring progress as we work to attain your optimal health. And this includes hs-crp, or C-reactive protein, and that's a measure of inflammation in your body, which underlies most, if not all, chronic diseases. The second is homocysteine, and that's a measure of your body's ability to methylate, and that's how your body turns on and off your genes and your DNA. And it's also an important process where your body gets rid of metabolic waste products and modulates your hormones. Another test I routinely order on patients is magnesium, and it turns out that the majority of Americans are actually low in this critical mineral nutrient. It's a cofactor in well over 400 different enzymatic reactions in your body, and if you're not optimally well, this is certainly well worth a look. And the same is true for vitamin D. Most Americans are chronically low in vitamin D, and vitamin D is not just something that you get from sunlight. It affects your immune system and many other disease risks in your body. Lastly, DHEA is the precursor for all your steroid hormones, and in patients that are chronically stressed, this often goes chronically low, and it can affect your mood and bone density and libido and many other functions in the body, so it's well worth a look. Most primary care providers and most insurance companies are not going to cover these tests, so that can be a problem and an obstacle to getting optimal health care. Now let's talk about costs. The first 5 tests alone without insurance cost over $400, and the second 5 tests without insurance cost over $800, bringing the total cost to well over $1,200. I am very proud to help people escape the issue of money in healthcare because I have entered into an arrangement with Quest Diagnostics, one of the largest and most respected national laboratories in the United States. And I can offer all of that testing for you, including the draw fee, for just $150. That amounts to about an 88% savings for these critical lab tests that will help me understand what your risks are and how to get you optimally well. Uh, so the deal I have with Quest is not just limited to those 10 tests you saw earlier, but includes basically all of the Quest Diagnostics testing menu. For example, for women, I would routinely also order ferritin and serum iron if that was a concern. We can give hormone panels. For men, PSA or prostate specific antigen is important to measure, as well as free and total testosterone. I would say the vast majority of my patients present with concerns about fatigue. And so this is an indication that we probably want to do some advanced thyroid testing, including reverse T3 or RT3, as you see it here. And that's a test that basically I have never seen a conventional doctor willing to order this critical test that often explains why patients who are having thyroid symptoms, despite having a normal TSH, actually have a deeper thyroid issue that most conventional doctors aren't willing to look at. Another measure I use for patients in fatigue cases is a morning cortisol or AM cortisol test. And there's a lot of other testing that we can do, again, at this phenomenally reduced rate. So I'm very excited to be able to offer that. Who benefits from this test? If you don't have insurance, obviously, you're going to be paying those uh, high prices to get this testing unless you get that testing through me. Patients who are insured but have high deductibles, I have many friends here in Washington State who have $3,000, $5,000, up to $8,000 deductibles. And what that means is that routine testing is not even going to make a dent in that size of a deductible, and they're going to be paying out of pocket anyway. So getting your testing through me will dramatically reduce your costs. Also, if you're simply just looking to ensure optimal health by ordering lab tests that go beyond the conventional tests, this program is for you. So, how you get started with this is you first go to my website, trmorrisnd.com, and you download the intake paperwork. I'll warn you now, it's substantial, and you've got about 12 pages to fill out where you're going to be detailing your current health concerns you have, past lab tests, medications and supplements you may be taking, a timeline of significant health events, and other indicators about your current lifestyle. And what that does is it gives me a giant leg up on understanding who you are and what your concerns are and how you got to your current state of health or disease. Then I would like you to locate a Quest Diagnostics Service Center near you, and this is easily done with an online web search. I've got the web link there, but if you just Google Quest Diagnostics Service Center, you'll find the link and be able to locate those. Then I want you to send that information to me, ideally via email, or you can fax it in, and so I'll have your intake and the location of the lab that's most convenient to you. Then we'll schedule a 20-minute brief consultation where we'll go over your intake in a fairly short order. This is not a detailed consultation where we would likely be getting to treatment recommendations. Um, and through that process, we may select some additional testing for you that's appropriate in your case. And in so doing, we're going to leapfrog over an additional visit where you might first get the first round of testing and then be seen, and then have a second round of testing and then be seen. So this is much more efficient for you. Then you're simply going to have your labs drawn, and I can email the results to you when those come up, and I'll indicate to you in that email whether or not there's something that we should be following up on. Um, and if you need a follow-up, that can be billed out at our regular rate of $150 an hour or $30 per half hour. So basically, the program I'm offering to all new patients through June of 2018 is a $50 consult and $150 for over $1,200 worth of laboratory testing. It's my pleasure to offer this to you, and I look forward to serving you. Thank you for your time.